President and CEO of the Asheville Area Chamber of Commerce. Thank you for being with us this morning. I want to express appreciation for the level of collaboration between the public and private sectors during this crisis. It's one of the silver linings of this moment, and the town halls we're holding today and tomorrow are another example of how we've worked together, and it requires all of us to continue working together to get through this safely and get our economy restarted. So let's talk about what this meeting is and isn't. The meeting is about giving the health department the opportunity to listen to business owners about your ideas and best practices around safely conducting business as we continue to deal with COVID-19. It's also a time for them to hear about the things that you haven't figured out yet, whether it's where to obtain masks or sneeze shields or gloves, or how to ensure social distancing is accomplished, or any of the hundreds of other issues business people have to deal with when operating during a coronavirus. What this meeting isn't, it's not a time to lobby the health department about whether or when or we reopen or not reopen. You won't come away from this meeting with a deadline for when you should prepare to reopen either. What you will get is a better understanding of how those decisions will be made, which will help you in terms of your decision making for your business. We are recording these sessions and we'll be asking you to make use of the chat feature to give your input. That will allow the health department to have a literal record of what you've said. And we're doing 7 of these in 2 days, so the transcript from the chat feature will help. Today, we'll hear from Fletch Tove, Public Health Emergency Preparedness Director for Buncombe County. And then we've asked representatives of the industry to join us to serve as conversation starters who may spark ideas or questions you want to pursue. And we'll ask a series of questions that we'll ask you to respond to in the chat feature so we can get that transcript. We hope that by doing this, we can identify any community-wide barriers that we need to address, that the health department will have a better context for decision-making about businesses reopening, and that you as an owner will start your preparations for reopening so that you're ready whenever that day comes. I also want to let you know that what we're collecting here are ideas. Just because we discuss an idea and like it does not guarantee that that's the way things will go. It is the health department's responsibility to determine which ideas provide adequate safety, not ours. So let's get started. I want to introduce Fletch Tove, who's going to give us an update on what's been going on around the coronavirus.
Hey, good morning, everyone. Can you hear me? Heather, you want to go to the next slide? All right, so good morning. My name is Fletch Tove. I'm the Emergency Preparedness Director for Buncombe County. Just kind of want to give you guys an update about where we stand as a county, as a state right now. So as a state, as of yesterday, we had over 8,000 cases, positive cases ongoing. Going into the weekend here in Buncombe County, I think we had 52. So the big shift over the last week is a lot of states are looking at, how do we reopen now? So no timeline on that, but what we did get last week from Governor Cooper in his coronavirus task force is a set of metrics that they're looking at to determine when the time is right to open. They have those metrics about positive case counts with a rolling 7-day average, and some other epidemiological data. And then they also gave us 3 criteria we need to successfully and safely reopen. That's increased testing for everyone, greater capacity for contact tracing, which is when you have a positive case going out, finding all the people that person had contact with, and then checking them, and then downward data trends and for leading indicators. So that's a great roadmap for us as we're looking to get to a new normal. Locally, we're pursuing that three-pronged approach that Governor Cooper pointed out. So we know slowly but surely we are increasing testing capacity in the county. We're building up a team and some depth and awaiting some state training so we could greatly expand our capacity for contact tracing. We've got a plan in place for that, so I think we'll be able to scale up pretty quick as that need arises. Because what plays out is as you do more testing, you're going to find more positive people, and that in turn leads to a greater need for contact tracing. And then the trends, they gave some specifics on that last week, and we're looking at the state trends, but we're also looking at those same trends locally in Buncombe County. And then the other part of the approach that Governor Cooper laid out yesterday was the return to normal in a 3-phase system. So when we meet his initial criteria, we'll go to phase 1 of reopening, which slightly relaxes some restrictions for mass gathering limitations and opens up some industry that's previously closed, such as non-essential retail, and remove some limitations on some other industry that's been open. And then we'll be in that for several weeks, and when the conditions are right, move to a phase 2, and then eventually a phase 3. From the timelines he pointed out, best case scenario, if we move through everything in turn, we'll begin the phase 3 in mid to late July. So just want everybody to have that have a mindset that this isn't a May kind of thing. This is a May, June, July process. It's going to take most of the summer to get back to that new normal if things go well. This group in particular with a childcare and adult daycare is a little bit unique in that a lot of you guys weren't restricted locally. I know a lot of you closed just of your own, being proactive on your own and not feeling comfortable with the situation and having the supplies and resources to safely operate. So looking forward today to the conversation about what we can do to meet those needs for you and guide you guys along as we look to reestablishing operations. Because we know with this discussions we've had internally are that as you start opening stuff up without schools in, people need daycare and adult daycare so they can put their loved ones in those so they can return to work. So it's definitely a phase 1 operation we need up and running. That's it for my update.
Thank you, Fletch. And that is an interesting time frame. I just want to emphasize that although it's a long time frame, comparatively speaking, now is the time to begin thinking about preparations for each of your businesses, because it may take a while to obtain the appropriate materials. So now we're going to talk with Jenny Vile, the Director for Childcare Resources, to talk about how you can be prepared to reopen. So Jenny, talk to us a little bit, please.
Hi, good morning. And like Fletcher said, we have 41 programs that are still currently operating in the county, including those YMCA sites around the county that have been serving school-age kids since schools closed, and an additional couple of programs that are open and are serving children virtually, connecting daily with their families, and so there's lots of resources. The Division for Child Development and Early Education really leapt into action early on and have compiled some frequently asked questions on their website. So starting with that, right? Starting with the licensing body, making sure that the new rules that are in place temporarily to operate in these times. Programs are being asked to follow some additional guidelines. Environmental health, I think Melissa is here. Environmental health has come up with a checklist of additional guidance for Buncombe County that programs need to be taking a look at, and I think that will be sent out soon. Chrissy Wolf, the childcare health consultant with MAHEC, is available and has been communicating with programs daily around how to alter their routines and their cleaning, how to make the morning check-in, doing temperature checks and those kinds of things, health screenings in the morning, how to make that run smoothly. She has been able to order thermometers and offer those to programs as needed. We currently have an order in for more, but those are coming. Our website, I'm going to type it into the chat at Buncombe Partnership for Children. We have a COVID-19 resource page that has things for families, but there's a whole section for providers, everything from financial resources, loans, forgivable loans that are available, to other types of support that are available both locally and around the state and also federal funds. And also, as you prepare to reopen, looking at the emergency COVID-19 vouchers that are available for families that have, as the financial requirements have been raised. There are a lot more people that qualify for those than qualify for regular subsidy vouchers. So making sure, and people families apply for those at the center. So definitely make sure that you are able to answer some questions about that, or refer to subsidy or to our office at the partnership. Our staff is our Childcare Resources staff, and other staff is available to help talk through, classroom things. We know that children are going to have a hard time coming back to school, right? Whether they've been in a really great situation at home or whether they've been having a harder time at home, coming back into group care is going to be different. And so our staff is available to really talk through that and how you can kind of plan for the social emotional needs of kids as they come back to school.
Well, Jenny, thank you for that for the web address in particular. And you might want to go back and add a phone number into the chat. If you would. Anything else that you need to share?
I don't think so. Just let us know what you need and we can figure it out. We also have supplies available, cleaning supplies. We're working on getting 2 fabric masks for every teacher that is working right now. Hand sanitizer just as soon as we can get it, cleaning supplies, diapers and wipes if you're having trouble getting those. So definitely be in contact. I'm going to put my phone number here, and do not hesitate to reach out.
Well, and I want to mention that I've been in conversation with the folks at the Dogwood Health Trust who have been attempting to get personal protection equipment for the healthcare industry. And I said, are you working with the business industry? And they are more than willing to do that if they can get a sense of the type of materials that are needed. So folks, if you're out there and you have specific needs, I mean, first of all, it sounds like that Jenny has good contacts for resources for you, but we're trying to get collective data about the types of materials, whether it's masks or gloves or cleaning supplies or whatever it might be. Please enter that information into the chat. That would be helpful to us. I don't know how we're going to extrapolate it out and figure it out overall, but and we'll have conversations with the county about it as well. Thank you, Jenny. I want to move on to Elizabeth Williams. Elizabeth is the Executive Director with Mountain Care to talk about adult care. Good morning, Elizabeth.
Good morning. Excited to be here to be part of this community conversation to talk about adult care and how we start to reopening. So one of the tricky situations for us is that we serve a very vulnerable population. But as Fletcher alluded to earlier, we also serve people that are needing to go back to work. So we have mothers and fathers that are coming to Adult Day who are in their 80s and their 90s, and their sons and daughters in their 20s, 30s, and 40s are having to work during the day. And as things reopen, those folks that are having to work and having to care for an elderly mother or an elderly father often look to us at Adult Day to have take care of that parent for them. So, but that parent fits into that elderly population that is at high risk. So right now, we are not opened. We serve adult day in 3 counties. We have 5 programs, and we're in Buncombe, Henderson, and Transylvania. And those adult day services are closed. So we're looking to the governor's 3-phase plan, and that is a great roadmap for us of where we come in and what's the best phase for us to begin services in congregate adult centers. So right now we are looking to phase 2 and to phase 3. So if those phase 1 is continuing to limit gather no more than 10 people. So that does not allow the congregate sites to really open back up. So looking to phase 2 to start reopening, start to getting ready for that. So getting policies in place on what that means, what PPE equipment we're going to need, what cleaning equipment, what we need, what infection control policies that do we need that are different than our normal infection control policies. Starting to look at our infection control policies in return to, does it specifically address COVID? So right now, it doesn't specifically address COVID. It has to, the flu and measles and your normal infection control. So making sure we're reviewing that. And who do we notify if we think someone has a COVID symptoms? How do we isolate? Just making sure that those are included in all of our policies. And then really we have to have policies in place for phase 2 and for phase 3. And so that's what we're doing right now. That's what we're really focusing right now. And I shared some of those to send out. Part of that first phase 2 policy is really, really strict visitor restrictions, really strict screening, doing temperature tests, making sure that it's not just the person, have any symptoms, but have they been with anybody that has any symptoms? And again, because this is the elderly population that we're serving. And so just wanting to make sure that they're not living with someone that's having COVID symptoms, or they didn't go bring food to a friend of someone who had COVID symptoms. So, the good thing is we have staff that is really, really cares about the population that they serve. And so screening them every day, having them attest, and I included this in some of the materials, having the attest that they have not had contact with anyone with COVID, they're not having any symptoms, they're not going into any areas that have high COVID cases. Let me think what else. I think that's really, I think where we are in the conversation of getting ready for phase 2. What does it look like? Making sure we have the policies in place, making sure we have the supplies in place, and then getting ready subsequently for phase 3, which is going to be different policies, different supplies, different procedures, and just making sure we have that all together.
Elizabeth, are you using a checklist or anything? How are you going about it?
Yeah, so I included that in our policy. So the screening, it is a checklist, and part of that is going back to that infection control policy, making sure we're collecting information to do tracing. So making sure everyone that's coming in is signing in. We know who they are. We're screening them. We're getting the symptoms, and if someone does come back with symptoms, we're able to go back and know, okay, these are the people that came into the center. So really wanting to make sure that we're collecting that information. The attestation forms are attached also. And so that we're collecting those. Every staff person is signing those, that they agree to share that information. Every single time they clock in, they're attesting that they do not have these symptoms. They've not been in contact with anybody, etc. Does that answer your question?
Yeah, it does. Now, note, may people call you if they have a question, or email you?
Yeah, so I included my email and telephone number. So one thing I love is sharing information and sharing resources and being part of a conversation and not working in a silo. So I'm happy to talk to others about what they're doing and share what we have. Yeah, and my email and phone number are on the slide.
Well, thank you for that. I appreciate it. We're going to move on to Amy Spooner. I understand we're going to be hearing you, Amy, and not necessarily seeing you this morning, who's going to talk about some sample ideas or strategies that could benefit the childcare industry in reopening. She is with the Irene Wortham Center. Amy, good morning.
Good morning. Can you hear me okay?
Yes.
Okay. So what we put into place is before families bring children, we have sent them information on how our drop-off procedures will go. So what we put into place is that only one family at a time can drop off. We have something posted for other families to wait at the top of our stairs, so that way we maintain the 6-foot distance or more. And the teachers check in children that are only assigned to their classroom. So the parents come down, they stop 6 feet away from the door. The teachers ask them if they've been exposed or if anybody has fever, cough, or shortness of breath. If they haven't been exposed or there is no symptoms, then they will take the child's temperature. And record it, but before they get to the door, what I missed is that they have a face shield on, their mask, gloves, um, before even opening the door to limit some of that exposure. Um, and we're using no-touch thermometers, so they're not even touching the child when they're first checking them in. The child is then either handed a sandy wipe, or the older children, they give them a squirt of hand sanitizer to clean their hands at the door before walking down the hall to their classroom with their assigned teacher. And then they wash their hands again when they get into the classroom. And what we set up for classrooms is we did make some child masks, so that way the children had some masks to try to take away some of that fear of why all these adults are wearing masks. Um, and we have kept the classroom very low ratios right now, with 2 staff assigned to a classroom when they basically only need 1 staff to meet ratio. That way they have help with sanitizing the classrooms throughout the day when the children go out to the playground, and make sure that we're hitting a lot of the commonly touched areas. All of our soft items have been taken out of the classrooms because they're not sanitized easily. Um, and we are making sure that only 1 classroom at a time is outside on the playgrounds. And when that classroom comes in, the playgrounds are sanitized. The high touch things like the tricycles, the railings going up to the slides, things like that, we're sanitizing those before the next group comes out too. So for the staff, we're maintaining areas to keep social distancing of 6 feet, such as our teacher break room, teacher workrooms, or our cafeteria, limiting the number of staff that can utilize the space. The staff need to wear masks in public spaces, and they're encouraged to try to keep their masks on as much as they can in the classrooms with the children. Having the staff sanitize the high touch areas throughout the day, doorknobs, bathrooms, workrooms, break rooms, cafeteria. Um, and we're also encouraging staff not to go offsite on their breaks. So we've provided extra snacks and drinks and things like that, so they wouldn't want to go to the gas station and say, get a soda. We split our staff into 2 groups, so that way we have 1 group of staff that's here for 2 weeks, and then the next group would come in. That way, if there was any exposure.
Oops. Amy?
All right, is that better?
Yeah.
Okay.
Those
um,
buttons are tough, I'm telling you.
So that way, we have a little bit of a backup plan. So if we had to send some staff out for the mandated time, we have other staffs. That way all children are still taken care of and the staff are safe there. Some of the struggles that we've seen is being able to feel secure, to have enough of the supplies, the hand sanitizer and things like that. Ordering them, it's taking a very long time, more than it normally does, to get these supplies, such as when we ordered the no-touch thermometers. They said they'd be here, in 3 days, and it was 2 weeks later or more before before ours arrived. And then planning for the future, after May, where will the funding come from if we're still low enrollment, to keep things operating, and making plans on how to get to full operating capacity in a safe manner, especially trying to do the social distancing. Children need social contact, to really thrive. And if we're taking some of that away, what we're concerned with is how to meet those needs of those children to help their social and emotional development.
Gosh, complicated. I mean, every business is complicated, but when you're dealing with people, whether they're small people or older people, it's complicated. So I'm hearing you mention lots of different equipment needs. And again, Fletch talked about a pretty long period. I urge you not to wait in your planning to reopen. And if you're already open, obviously you understand what the ongoing needs are. But for those who are reopening, you need to think about not just the equipment needs, but the staffing needs, the needs of the population that you're dealing with, whether it's children or adults. It just sounds like there's a lot going on there. Amy, is there anything else you want to share with us?
Just utilizing, people in the community. We had some people that had made and donated masks or made face shields for us, utilizing contacts just to help each other out.
Great. Well, we appreciate you being with us this morning. We're going to move into the section where we're really asking you to use the Zoom group chat to share your ideas and strategies. Maybe there are resources that you've thought about or have utilized that have helped you begin to organize to reopen your business. And so if you could share any ideas that you have or strategies that could benefit your industry, it's important that the health department, feel free to go ahead and start filling them in, because we're just going to be talking and stretching the discussion time while people are entering ideas, because we want to provide those to the health department. So as they're thinking about things, especially if you have an idea that you're not sure will work, or you want to make sure that it's related to public safety and would be an acceptable type of measure, then enter it into the chat. In talks with earlier, and particularly in discussions with Jenny, she indicated that there were a variety of places that you could go to for information. Jenny, why don't you talk about those, unmute yourself, and then talk about the various resources again, if you would, please. So for those that may not have been looking at this.
Sure. I would start, and I for those of you that know that were paying attention early on, I know that the Division for Child Development and Early Education had some conflicting information early on that was a little frustrating for all of us. But I was really pleased when I started looking back at the website. They have compiled a really nice FAQ document that links to everything else that is on their website. That I saw last week. So that is there, that has all of the current guidance and the current, where you can get information about what and where you can find the kind of expanded documentation. So I would definitely start there. And then I think it depends on what you're looking for. Please remember that the payroll protection loans reopen. I think they reopen either, if they didn't reopen Friday, they're reopening today. So definitely, if you have not applied for those and you would like to, definitely don't wait on that. There are a couple of small financial opportunities that are happening. The Children's Childcare Services Association has it's a couple $100, but that is available on our website, or on our Facebook page, actually, if you'd like to apply for that. There are a couple of other initiatives underway. Oh, good, there it is. Aaron just said that it reopens today at 10:30. The payroll protection line.
Right, and you can go to, we've done a number of town hall meetings and informational sessions around programs that are available to business on the whole. So whether it's through the Small Business Administration, local grants, there are opportunities that exist. So you can look at that. There's a link on the chat that you can use ashevillechamber.org. And as you look at the resource page /coronavirus, there are links to all kinds of programs that can help with bridge funding, loans, things of that nature from a business perspective. I want to go to Elizabeth Williams. She perhaps has some ideas to share as well.
I was just asked the question as to what we're doing to support the participants now that are, since we are closed. And so I just wanted to answer that. I thought it was a good question, just in case anyone else had that question in the chat. So we are doing a lot to actually support the participants right now, and keeping them safe at home and minimizing contact. But so we are doing weekly, sometimes 3 to 4 times a week, depending upon the caregiver and the family. We serve about 220 families. So we're calling them weekly. What do you need? What resources do you need? What support do you need? We're doing caregiver support, Zoom. We have lots of new caregivers who are joining that, which is great. Folks that haven't taken advantage of that service before. We're delivering food, we're delivering meals, we're delivering supplies as needed. So we feel really good about what we're able to do now. The big thing that they're not getting is respite. So again, 80, 70-year-old, 90 person that is living with cognitive issues or physical issues in home with their son or daughter or husband or wife, 24/7 for now weeks. So it's that respite piece, but we're really trying to work on the social isolation, having staff members call them, doing lots of video chats, et cetera, to making sure that they're getting as much support as they can right now.
Thanks, Elizabeth. I appreciate that. Let's move to the question, what resources are needed to provide these services? We've been talking about them, but are there things that you need resource-wise? There's on the chat, Tiffany mentions clarifications on age groups care and what constitutes childcare and summer camp, and communication from the health department to families about these determinations. That's a resource as well. But what other types of resource do you need? Please respond in the Zoom group chat. We've talked about some of the physical resources, whether it's the cleaning supplies or masks. And it's interesting. Do you supply your staff with masks, or do you ask them to come with masks? Amy, do you have a response on that? How do you deal with supplies? Do you ask, particularly related to masks, do you need to have your own mask, or is work supplying the masks?
Well, what we've done here is we've given our staff a couple different cloth masks, so they've been washed. We're not sharing masks; they're assigned, their own for that.
Okay, I see that. So you're using reusable cloth masks, and in the chat, Masks of Love, Western North Carolina, might be a resource if you don't currently have masks that you're able to use with. Who made the masks for the children? Amy, where did you?
I did.
Really?
Yeah.
Well, I'm telling you what, this time period calls for flexibility and skill building that none of us knew we had. That's for sure. Let's see. And Childcare Resources has masks, Jenny. Good. I'm glad to hear that. So are they disposable masks, or are they temporary one-time use?
Our goal is a mix. We would like for every teacher to have a mask, a cloth mask that they can wash if they want it, but we have had a couple of programs request disposable masks. Our thinking is that they're going to use disposable masks for morning check-in with parents, and kind of people on the outside, and then switch to cloth for the day when they're with the same group.
Okay, great.
We are buying some, but we are also have gotten some donations, and would love more for then distribution out to programs that are already open, and then ones that are planning on opening.
Okay, great. Some really good suggestions being made here on the chat as well for other contacts for assistance. for assistance in general, but also for masks. So we're getting some good information there, which is great. So feel free to continue to add what resources are needed to provide the services that you provide, whether it's for adults or for children. Checking back to see if I've got anything else in here that needs to be addressed. All right, got a new message here.
Hey,
Cleaning
Kay.
supplies, yes.
This is Amy Berry. Good morning.
Good morning.
Hey, I just wanted to share something, circling back to your reference about Dogwood Health Trust
Yes.
and the support they can provide. Just because childcare providers that are open have been deluged with all kinds of requests, and they've been doing a fabulous job responding, but we know it's a lot on top of what they're already doing. So Buncombe Partnership for Children has applied for a grant to Dogwood Health Trust on behalf of the 18 counties in their catchment area, on behalf of the local Smart Start organizations like ours. And so we've been back and forth with them over a month, and they are accepting a revised request from us today, which will include funding for emergency supplies like cleaning supplies and masks for every classroom that's currently open. Perhaps instead of childcare providers on this call entering into the chat what their needs are, Jenny Weil and her team have been reaching out to providers that are currently open to get that data, so you don't have to provide it twice. So we've been assured that the response will be a quicker turnaround time from Dogwood. And the second part of that request, which is a much bigger ask but really important, Jenny referenced the financial strain that programs are experienced due to low enrollment. So we are asking for funding, general operating support based on loss of enrollment. So we hope that will come through, and we'll be keeping childcare providers up to speed on what's happening with that.
Well, thank you for that update, Amy. Really appreciate that. And Jenny entered in the chat that if you want to pick up supplies from the Buncombe Partnership, you should contact Natasha Bowden, and she includes the email address there. So make sure to note that in the chat. Also, so let's move on to the next question is, what gaps in service still remain based on the current guidelines? Or gaps in service. And I don't know enough to be able to speak to this. Elizabeth, do you have any thoughts about the gaps in service still remaining based on the current guidelines?
I mean, the big gap, which I sort of mentioned before, is that respite piece. And I don't know if there's a quick solution or easy solution to that. So it's, balancing that person's safety. And we all know that the infection and mortality rates for the older adults, particularly for adult day, are pretty high. And so that's a really hard balance. So what we're just trying to do is get ready to be open and be able to serve, and making sure that the environment that we're inviting these folks back into is going to be absolutely as safe as possible.
Amy, Jenny, either of you have any ideas about gaps in service that still remain?
Right now, there are a multitude of childcare slots. I put this in the chat earlier, but available just from programs that have remained open. Although I think that the gaps in service in childcare may possibly come towards the end of reopening, honestly, as programs, and we hope it doesn't happen, but I think we definitely will lose some programs just due to the financial strain. And so I think we're going to see more gaps as everyone goes back to work. I think we're going to have some families that are opting to keep their children home for a while, families that are able to do that. And so for right now, As far as families wanting to access childcare, there should be no gaps. There are lots of slots, but which is new for the county. We've been talking about the lack of slots for several years. So yeah, I'm afraid at the excuse me, at the end of reopening, that we may see some gaps. Absolutely.
Amy, any thoughts?
Yeah, I think some of the gaps on getting back to being fully enrolled, but the other gap that I'm seeing for families and for children, especially since we have about 40% of our enrolled families receiving some type of service for a developmental delay, these children are not receiving these services, or they're receiving them remotely, which by the notes that we're getting back is not benefiting the child in those areas. So I think when we get back into having children here, seeing children that have regressed and trying to meet those needs and bring them back up, along with the social emotional piece of getting back into a new type of routine.
Flexibility has been something we've all had to learn and try and convey it to children and to older adults who may have health issues, and it's a tough role for the folks in the child care and adult care industries to play, yet such a critical part for allowing the rest of the community to get back to work. If you have, I think we'll just move to the end here. I'm not seeing many things come up on the chat. And I want to share with you a couple of things that I would ask for you to think about. If you have thoughts that you would like to share, number one, you can email business@buncombecounty.org. That information will be fed to the health department and to other appropriate roles. So make sure that you utilize that opportunity. I also want to share with you that we did an initial survey of business owners, and that information was super helpful to local decision makers in deciding just what the situation was. I would ask that we now have a second survey. I would ask you to go to ashevillechamber.org/coronavirus and look for the survey 2. We would appreciate your completing it. It'll be presented to decision makers as well, including the General Assembly members through our advocacy program. But we want to be able to tell them how your business is addressing issues related to coronavirus, and we would appreciate your completing it. It's not super long, and that information would be very helpful to elected leadership. Child care and adult care are very important programs in order to help the rest of the community get back to work. And I understand the tension between maintaining underutilized services right now and then being prepared for when we do get back to full force. But we do want to eventually get back to full force safely. And by working together, we're going to be more capable of doing that. Together, we're more resilient. So we thank you for joining us and sharing your collective wisdom with us today. And we thank our partners in local government who are working to keep us safe and healthy. Please send us any additional ideas to business@buncombecounty.org, and stay safe. Hopefully we'll all be back to work soon. Thank you so much.
Okay, may I interrupt? And Jennifer Teague had a comment that she wanted to make before we end. Can we allow her to do so?
Absolutely, Jennifer.
All right.
Great, thank you. Good morning. Thank you for hosting this. I just saw over in the chats there was a comment about planning for more abuse situations occurring for both children and seniors. And I'm the program manager for Adult and Aging Services here with Buncombe County, and just wanted to say that all of our services are still running. CPS and APS reports are still being taken. We are still out in the field assessing reports as they come in. We encourage anyone to make reports if you have any concerns. We're also doing some prevention and outreach services, specifically within adult services. If you know of people who don't have food access and aren't able to get to the grocery store, we're assisting with some temporary food for them. Our reports, I will say, are actually down right now, and in child services, that's very concerning. From my peers, we understand that this is usually a very busy time, and without having children in school, there's not as many eyes and as many people interacting with them, and it is definitely a concern. Just want to continue to remind everybody that we are here, that all of our staff is still working. We are still going into the field and assessing reports. So please continue to make those if you have any questions, concerns, or comments.
Jennifer, thank you for that. I'm sorry I missed that in the chat. Any last comments? All right, again, everyone stay safe. Please, if you haven't been currently operating, please be making your plans about reopening and utilizing the resources that exist. You're an essential business, and we greatly appreciate the work you do. So thank you again for joining us and giving us your input. Thanks.